Smoking, the practice in which a substance, most commonly tobacco, is burnt and the smoke is inhaled or tasted. The active substances in the drugs found in the smoke aids the absorption through the lungs and into the circulatory/respiratory system. The most common method of smoking today is through cigarettes, but can be primarily administered through loose paper rolls, cigars, pipes, and bongs. Smoking has its bad effects. These effects have killed 4.9 million people worldwide and have caused many deadly diseases such as lung cancer, heart attack, and birth defects. Overall, smoking is a meaningless action. Today I will be talking about how smoking affects the circulatory/respiratory system, how the two substances nicotine and carbon monoxide affect your health, and some healthy options of overcoming addiction. The tar in cigarette smoking is the greatest contributing factor to lung cancer. Other substances act as carcinogens when the smoke goes through the trachea, bronchi, bronchioli, and alveoli. Tobacco smoking causes irritation of the windpipe and voice box. It reduces lung function and breathlessness due to the swelling and narrowing of the lungs' airways. It destroys the lungs' filter systems, which leads up to the building of poisonous substances and increases the risk of lung infection. Smoking affects the constriction of blood vessels in the skin. This creates stickier blood that is prone to clotting and raises blood pressure and heart rate. Smoking damages the artery lining, which contributes to fatty deposits on the artery walls. This leads to an increased risk of stroke and heart attack due to the blockages of the blood supply. Nicotine is a stimulant. It is an addictive substance in tobacco that causes smokers to continue their smoking habit. Addicted smokers need enough nicotine over the day to feel normal. Nicotine affects the nerves in the brain that regulate heartbeat and breathing, thus constricting blood vessels. Carbon monoxide is an odorless substance that is fatal in large doses. Carbon monoxide takes the place of oxygen in the blood, which means less oxygen reaches the brain, heart, and muscles. There are many ways to overcome addiction to smoking. You can get some friends to remind you that you can get better every day. You can predict your weak spots, distract yourself, or work out. Decide how you think about yourself and who you will allow in your life. Keep track of your addiction and remind yourself the reasons you want to change. Set specific and measurable goals. Reflect on your thoughts and ask yourself important questions. Have compassion for your efforts to quit. See it as a sign of strength. Assess how willing to change you really are. List the pros and cons of quitting, as well as the costs of continuing your addiction. Consider things that are important to you. Perhaps join a recovery support group on the internet or in real life. You can benefit from the shared experiences of the group members.